The Pharmaceutical Society of Kenya is now warning about what it calls the indiscriminate use of sexual performance enhancing drugs. The society says the drugs, commonly known as the blue pill, could lead to severe side effects such as vision loss and heart failure if used incorrectly. The society says the drugs should only be used on the strict advice of a qualified medical practitioner. Earlier, I went out to find out about this latest medical concern in the country. At Good Life Pharmacy here in Nairobi, they have a good stock of sexual performance enhancement drugs given here strictly under prescription. There are at least 4 of such drugs available in the market, coming in brand names such as Viagra, Stendra, Cialis and Levitra, all commonly known as the blue pill. So this here is the blue pill. Kindly take me through the different categories and which one is in the highest demand.
So Viagra comes in 25 milligram, 50 milligram, and 100 milligram. 50 milligram is a regular dose that is taken once daily, an hour before the engagement. So the 50 milligram is one that you'll find in every shop, in every market, because that's also the original dosage. But then, even with the 50 milligram, it is just taken once daily.
Medics say in recent years, these drugs have become increasingly popular.
Viagra is supposed to be a prescription medicine. We are in a market that customers are still requesting for this medicine under low tones.
According to medics, the drugs are effective in up to 70% of men who have the medical condition known as erectile dysfunction. But now, pharmacists are warning about increased misuse of the drugs. In a statement released this evening, the Pharmaceutical Society of Kenya says misusing these drugs could lead to many side effects, such as nose bleeding, insomnia, and even serious ones such as vision loss and heart problems.
Some people will get some dizzy spells, some people will get headaches, some people will get a sustained erection that cannot go away. Okay, this is for the young group of people. All right, the elderly people, some of them will have difficulties in breathing, okay, because they're already having compromised blood supply in the areas that they're supposed to go to. Some people actually get heart attacks, and some people die.
The earliest you start seeing the side effects of this medicine is you start seeing flashing, headache, blurred vision, any confusion. Those are at that time you need to raise an alarm. It is so easy to understand or to see or to diagnose a patient who is already getting the side effect and raise an alarm and call an ambulance that I have a patient here who is prone to get a stroke or heart disease, and you still have like 30 minutes to save that life. You don't have to get embarrassed and run away like we have seen in our nation. You're wondering, where do I start? This is already a police case. It's not a police case, it's an emergency. You need to call and say, I have someone here who is exhibiting signs of heart struggle. I need somebody to come and help. That life will be saved.
Okay. Now, the other issue that comes about now is the regulation, because this is a medication which is supposed to be prescription only. Why are they not being prescription only? Because for me to prescribe a medication, somebody has to come and pay consultation and they analyze them. And people want shortcuts. Okay? When the shortcut appears to be paying, people will take it. Okay? Somebody come into my office as a urologist, I will go through them, okay, to find out what other underlying condition they have that maybe makes them not be able to have an erection. Those conditions that they have will kill them if they exert themselves.
According to medics, some men are now using these pills as recreation drugs, and increasingly even younger men are resorting to the blue pill with potentially deadly consequences.
There's a group of people who are using them as recreation drugs, okay? Because some they falsely believe, because of the marketing, that they will make them be Superman, okay? So you have a lot of young people, whenever they have a party in an afternoon or an evening, they actually go and purchase Viagra. I know that because we get to see some of the side effects of these people who have used these medications. Now, among the young people, usually what they will have is priapism. Priapism refers to an unwanted erection. Okay, somebody might use a medication and then they get an erection. When they no longer require that erection, it's still persistent. Our senior population, the dangers, of course, are the worst complication is death. Okay, because when somebody uses this medication and they have underlying conditions which do not allow them to exercise, unless those underlying conditions have been addressed, when this person engages in the sexual activity, because now he has an erection which he wants to use, the result will be he will collapse. Okay. There are other people who are already having some medications that they are using for the underlying conditions which react with the medication that they are, with the performance-enhancing medication that they want to use.
Dr. Misango advises that if you think you might have erectile dysfunction, your best bet is to see a doctor.
When we have erectile dysfunction occurring in a younger individual, by young we mean somebody less than the age of 40, between 40 and actually below the age of 40, usually there will not be any underlying condition apart from just some, we call this psychological issues. But when somebody is older than 40, usually there will be an underlying condition. In most of the situations, there will be underlying reason. And as urologists and in the medical cycles, we look at erectile dysfunction, the inability of a man to have an erection, as being an indicator of an underlying cardiological condition.
He cautions that some men who don't have erectile dysfunction but use performance enhancers may also become psychologically addicted to the medicine and depend on it to get an erection. This, he says, could eventually lead to erectile dysfunction.
These medications definitely are useful, but when used in the wrong people or when used wrongly, they are harmful.
The Pharmacy and Poisons Board in the Ministry of Health says it is, in fact, illegal to sell these drugs without a prescription.
So in terms of the people who are supposed to take this drug, it's very clear. Number one, they are supposed to be male patients. Number two, they are supposed to be adult, above 18 years. And they should have a diagnosis of erectile dysfunction from a medical practitioner.
Because of the sensitivities around this topic, most of the men I approached to get their thoughts were uncomfortable talking about their sexual health.